Have to tell you the simple timeline of COVID infection. The COVID infection can be crossly divided into infective phase and another is inflammatory phase. Infective and the whole cycle you can consider around 28 days. So first half 15 days will be infective phase and second half will be inflammatory phase. In the infective phase, the first half, that is almost 7 days, so 5 to 7 days, it will be incubation period. Incubation period means virus has entered your body but it is not it is replicating but not showing any symptom. That is what we call as incubation period. The first half, that is 7 days, is incubation time. You will not be having any symptoms. The next 7 days of the first half of the COVID related cycle, you will be start developing symptoms like cough, fever, body ache, loss of taste and smell, and sore throat, and like that. So we usually ask the patient to calculate their days of infection from the first onset of symptom. Either it could be fever, body ache, sore throat, cough. These are the symptoms. The first any of these symptom, the day of first symptom will be the day one. That's how we have to calculate. So most of the patients in the first 7 days of the symptoms, usually we advise home quarantine. So certain medicines are given and we ask them to monitor oxygen level. This fever, cough, or body ache and other symptoms should usually be there in for first 3 days. Then after 3 days, gradually the fever and other symptoms should come down. But if from the day of onset of any of the symptom, 5 to 7 days later, still the fever is increasing, breathlessness is increasing, cough is increasing. So that's where we think that patient is entering into the inflammatory phase. Not everybody enters into inflammatory phase. So most of us who get infected with COVID-19 will recover within the infective period, first 15 days of infection or first 7 days, 5 to 7 days of the symptom onset, they will usually recover. But those of the people who does not improve despite the 7 days of first 7 days of symptom onset, that is where we worry about the inflammatory phase, and most of the complication occurs in the inflammatory phase. So this is the COVID-19 timeline. So patients who are in COVID home isolation and home quarantine and taking certain simple initial medicines, despite after 7 days of symptoms, if the symptoms are worsening, fever is increasing, breathlessness and difficulty in breathing is increasing, tiredness is becoming very worse, and there is tightness in the chest and cough is becoming severe, these are symptoms should alert and you should approach. Should not be at home only, waiting for the oxygen to drop. Oxygen may drop much later.